Hello, my name is Dr. Richard Barnett. I'm an internal medicine physician in Longmont, Colorado at Frontier Internal Medicine for Boulder Community Health. All right, and we're going to get started today. The lecture is called Stop Prediabetes from Becoming Diabetes. All right, here we go. This is a picture that I'd like to show and kind of describe. So what we have here is our NBA Finals MVP, Giannis Antetokounmpo, who just won finals last night. The reason I bring it up is because he's doing something important. He's blocking a dunk, and I want us to think about prediabetes and management as if number 22, DeAndre Ayton, is prediabetes coming at you, and what we're going to do is we're going to swat it away. We're going to block it, and that's what we're going to talk about today. So some of the key points tonight, number one, diabetes, it's a devastating chronic condition. Prediabetes and diabetes are on different ends of the same continuum. Diabetes can be prevented, delayed with proper interventions, and that's that Giannis block that I was referring to, lifestyle choices, changes, and even small changes can be of great benefit. I think of all the things that we're going to talk about today, that's really the key point we're going to hone in on. Small changes can be of great benefit. So what is diabetes? Basically, it's our body inability to regulate blood sugar. There's type 1, there's type 2 diabetes. And what happens is you get insulin resistance. Insulin resistance is when the insulin in your body can't do its job anymore. Insulin, what it does is lowering glucose or blood sugar in the blood. And what it does is insulin works by moving the sugar out of the blood and into your body's cells. In the cells, the body uses the sugar to make energy, and this allows you to just be up and about. If this doesn't happen correctly, too much sugar stays in the blood, and when the blood sugar level is above normal for too long, it can lead to damage or diabetes. Diabetes is a shortened form of diabetes mellitus. You may hear me say diabetes mellitus. You may hear me say type 1 or type 2 diabetes mellitus. There's different abbreviations. It comes from the Greek or Latin term siphon, or to pass through. Mellitus is honey or sweet. Doctors in the old days would actually notice patients who frequently urinated, their urine would taste and smell sweet. The reason why is patients were dumping glucose in their urine, or sugar in their urine, creating increased urination, and then that causes that sweet taste to the urine. Thankfully, and fortunately, I don't have to do that in the clinic. We have more accurate tests for urine glucose now. So we're going to talk a little bit about type 1, type 2 diabetes, what it is, and how they are different. Again, diabetes is essentially your body has trouble regulating its blood sugar. There's two types. Type 1 diabetes, or autoimmune diabetes, tends to occur when either for a genetically mediated reason or an autoimmune response where your body attacks the pancreas, the organ that makes insulin. Insulin really helps regulating blood sugar in our bodies, like I said prior. That's type 1 diabetes. So it happens with kids earlier in life. It has a large genetic component to it. Type 2 diabetes is much more lifestyle related. So it's much more common. It can occur later in life, usually when we get older, associated with lots of risk factors that contribute to it. So primarily we're speaking about obesity, a sedentary lifestyle, excess alcohol use, those types of things. Type 2 diabetes occurs when the pancreas, which is the organ in the body that's been working overtime for too long, essentially more sugar in the body, you get bigger, you're not as active. The pancreas has trouble releasing insulin to keep up with all the blood sugar in your bloodstream. So that's when prediabetes occurs. If you let the prediabetes go too long, the pancreas and insulin burn out, and you can no longer regulate, and then you progress to diabetes mellitus type 2. This is when your average blood sugar is higher than it should be. And then, of course, in the later stages, you need insulin because your pancreas no longer makes any, the burnout. So we're going to be focusing mainly on type 2 diabetes because prediabetes leads to type 2 diabetes today. So not as much type 1 diabetes discussion today. Complications of diabetes, why do we, okay, so you have elevated blood sugar and you're urinating excess blood sugar. What happens in the blood vessels with excess blood sugar is it's an inflammatory process and it damages the vessels. So anywhere in the body that has vessels, it can be damaged. So if we're talking heart, coronary artery disease, or heart attacks, the brain, it can cause strokes if we lead uncontrolled diabetes. Eyes, it affects the eyes. That's why people with diabetes get annual eye exams. It can lead to blindness. It can affect your kidneys and cause kidney failure and have to be on dialysis. It can also affect your nerves, cause numbness, tingling in the fingers and the hands. And then it can also lead to foot ulcers that don't heal well because of the excess blood sugar in the bloodstream, and which unfortunately then can also, if it goes poorly, with complications, can lead to an amputation. So there's lots of complications to diabetes. What's pre-diabetes, okay? So we're talking about diabetes. What's pre-diabetes? This is when your blood glucose is higher than normal, but it doesn't meet the criteria for diagnosis of quote-unquote type 2 diabetes. Usually it's when your elevated blood glucose is less than 126, but higher than 100. Or if your doctor orders a hemoglobin A1c, which we'll talk about in a second, between 5.7 and 6.4. More than 100 million Americans have prediabetes or diabetes. It's estimated that about a third of adults have prediabetes, and some don't know about it. Much more common as you get older, as I had said earlier. Older than 65, half of the US adults with prediabetes. So this is the beginning of when your sugars are getting too high. This is the time to make changes. It's just your body is not responding to the insulin in your bloodstream. All right, so a little bit more about diagnosis. Here on the left, we have a normal, non-diabetic, normal blood sugar. This is when your blood sugar is less than 100 on a fasting blood sugar test. Or if you were to get a random blood sugar and you had eaten prior to your blood work was done, it was less than 140, or an A1c, less than 5.7. Prediabetes, which is what this lecture is about, is when you have a fasting blood sugar between 100 and 125, or your A1c between 5.7 and 6.4. And diabetes would be classically with a blood sugar higher than 126 on multiple checks. We don't really check just one high blood sugar. You have to repeat it to confirm. So what is hemoglobin A1c? I've mentioned that term a few times tonight already. It's a blood test. It's a pretty cool and neat blood test. It actually it measures the amount of blood sugar on average in your bloodstream over the last 2 to 3 months. So I had a patient actually earlier today call it it's the you can't cheat test, because some people with these fasting blood sugars, they'll work really hard that week before and their blood sugar looks good for the doctor on a fasting, but then we get an A1c and it tells me a little bit more over your life and how you live 2 to 3 months. So it's a really cool test. How does it do that? Well, in the bloodstream, glucose molecules, or sugar, will actually become stuck to the hemoglobin, which is the protein that carries oxygen in red blood cells, and the hemoglobin becomes quote-unquote glycosylated. These are these sugar chains that stick to the hemoglobin molecule. And so as a person's blood sugar is higher, more and more hemoglobin becomes glycosylated, and we get these A1c ranges. A1c higher than 6.4 is diabetes type 2, anything 5.7 to 6.3 is prediabetes. All right, risk factors for type 2 diabetes. Now, when we look at this list, pretty much everyone's at risk, unfortunately, in our Western society, kind of a sedentary lifestyle that some of us live. So, number one would be a high blood pressure. That's considered 140 over 90 millimeters of mercury. If you have a history of heart disease, cardiovascular disease, that means heart attacks, peripheral vascular disease, strokes. If you have a low HDL, which is your quote-unquote good cholesterol, you want to see that higher than 40, that's a risk factor for type 2. High triglycerides, overweight, smoking cigarettes, a first-degree relative, so family history, certain ethnicities are more prone to type 2 diabetes. Gestational diabetes, which is when a mother is diagnosed with high blood sugar around pregnancy, or if you have a history of polycystic ovarian syndrome, you're at risk for type 2 diabetes, also known as PCOS. Some of these are modifiable. So we're talking the blood pressure, cholesterol, being overweight, smoking cigarettes. Some are not modifiable, like your ethnicity, family history. And so lifestyle changes, choices we make each day, it's really important. Also, if you're age 45 or older and overweight with a BMI above 25, you could be at risk for type 2 and you should be tested. Age 45 or older, not overweight, you would talk to your doctor after a physical exam. And then under age 45 but overweight at increased risk for diabetes if you have other risk factors. Or if you're inactive, sedentary lifestyle. Not all pre-diabetics are obese or overweight. Okay, it's a common misconception. So if you're overweight, oh, you have bad blood sugar issues. Not necessarily. In a sample area of diabetics, 81% are overweight, 19% had normal weight for prediabetes. And this was the distribution of members with prediabetes for the Kaiser Permanente, Southern California Valley and Kern service areas. That's where that data is from. Okay, so if you have prediabetes, why do I care? Why do doctors care? Talked a little bit about it. If you have prediabetes, you're at increased risk for becoming diabetic, type 2 diabetes. And 70% of individuals with prediabetes actually eventually develop diabetes later in their life. So in other words, you should care because you might end up getting diabetes. A lot of people get it in America. If prediabetes is not treated, 37% of those individuals will have diabetes in 4 years. And people who have been diagnosed with diabetes on average have medical expenditures approximately 2.5 times higher than those without diabetes incurred. So that's another reason to care, finances. Also, prediabetes, it increases your risk for diabetes, which then, of course, would increase your risk for heart disease and strokes. Also causes an increased risk for blindness or retinopathy, changes in the nerve or neuropathy. Kidney disease is nephropathy. The total estimated cost of diagnosed diabetes in 2017 was $327 billion, which is hard to kind of think about, but this includes $237 billion in direct medical costs and $90 billion in reduced productivity. So kind of a lot of gloom, doom, but every cloud has a silver lining. We always talk about that in the office. Sure, you have this diagnosis. What are we going to do about it? Well, for prediabetes, if this was a cloud, thankfully, prediabetes is reversible, just with small changes. So that's the silver lining if you get told you have prediabetes. It's reversible. I'd like to give a clinic example of kind of how this presents in my office. So I have kind of played around with a case for the next few minutes. We have a 48-year-old female who presents to my clinic to establish care. No significant past medical history. Today she has no complaints. She just wants to get her annual labs done. She's been a little inactive during the COVID-19 pandemic. She also wasn't able to follow up regularly during the COVID-19 pandemic. She's coming in to get some blood work. No complaints. Her past medical history, she has no childhood illnesses. She denies any chronic conditions. A few years ago, she had a cholecystectomy, which is the removal of her gallbladder. Family history was significant for her father, who had type 2 diabetes later in his life, in his 70s. Mother was healthy without significant medical history. She lives in Colorado with her husband and her one dog. She works a full-time job. She does not use tobacco. She drinks about 3 to 5 glasses of wine per week on average. No known drug allergies. She doesn't take any prescription drugs. Sometimes she'll take over-the-counter vitamin C and zinc, obviously with all the COVID stuff. On physical exam, vital signs were stable. Her blood pressure was 132/84. Her heart rate was 16, not 68, excuse me, and respiratory rate of 14, apologize about that. Physical exam, she's alert and oriented, pretty unremarkable physical exam. To note, her BMI is 26.5, which we'll talk about why that matters. Laboratory findings, I get some blood, because after the physical exam we do some lab work. I get a fasting blood sugar of 115. And if you recall back to what we were talking about with diagnosis, that's in between 100 and 126. And her hemoglobin A1c came back to 6.2%. The rest of her blood work, including a complete blood count, her kidney function, liver function, electrolytes, are unremarkable, or normal, I should say. All right, so I'd call her on the phone for follow-up, probably the next day or within the week, and I'd say, hey, Miss X, Y, and Z, you have prediabetes. And what are we gonna do? We're gonna, number one, remember that even small changes can make a significant difference. Exercise is probably the number one part of this. We're talking about exercising 30 minutes, 5 days a week. Now, if in this clinical example, she works a full-time job, she might not have that much time. So this is something we would talk about to help. But mainstay, we always talk about working at least 150 minutes per week, 30 minutes, 5 days a week. Dieting, and we'll talk about that, and weight loss. And we'll talk all about that. That's kind of what the rest of the lecture is about, is how to manage prediabetes. A lot of people also like to know, when would you follow up? When do you want to recheck this quote-unquote A1c, this 6.2%? For prediabetes, we usually check it annually, 1 year, at your next physical exam. So the goals of treatment of prediabetes is avoid progression to type 2 diabetes, lower your blood sugars, and decrease our risks of complications of diabetes. A third of people who are diagnosed with prediabetes can potentially already have complications and symptoms. What kind of symptoms? We're talking maybe some eye issues or blurry vision, retinopathy where they have to go to the eye doctor, or they have neuropathy, their hands in a stocking and gloves kind of distribution. You have numbness and tingling. Nephropathy can cause swelling and foot damage or ulcers. So that's the goals. And like I said before with the case study, the clinic example, weight loss, exercise, and we'll talk about medications, but that's less common for pre-diabetes. Quickly, the diabetes prevention program, which actually Colorado and here in the Boulder Valley, we have that, and we'll talk about that too later. They did a study, 30 minutes a day of moderate physical activity, along with a 5 to 10% body weight loss, produced 58% reduction in progression to diabetes. This slide says it all, I think. Moderate physical activity and weight loss reduced your progression to diabetes. I didn't say anything about medicine. So I think for working on lifestyle choices, having positive changes in your life, if you get diagnosed with prediabetes, that's the mainstay, not medications. Let's talk a little bit about body mass index. I've mentioned that term a couple times also. In the clinic example, I said the patient's BMI was 26.5. This is a convenient way for us to measure your body weight relative to your height. The equation is weight divided by your height squared. BMI is calculated at all of your office visits. If you're getting a weight, you can have a BMI. So if you ever want to know what your BMI is, you just ask the office, the medical assistant, the doctor. They'll be able to tell you what range you're in. Body mass index. Here are the ranges. Anything above 25 is considered overweight. 25 to 29.9 is overweight, and then anything higher than 30 is considered quote-unquote obese. Again, BMI of over 25 is a risk factor for diabetes. I take the BMI with a grain of salt. I think it needs to also have a physical exam portion. Everybody's body's a little different, and I think muscle mass is important, so we do take that into consideration in the exam. But generally speaking, a BMI of over 30, there's usually some excess weight related to a sedentary lifestyle, generally speaking. Weight loss. The goal is a weight loss of 5 to 10% of your total body weight. Focusing on healthy eating, reducing your calorie count, and the optimal goal is to sustain a weight loss of 7% long term. This is a lot easier said than done. This is not a sprint. I say that all the time in my office. It's not a sprint, it's the long-term goal that you want to achieve. It's a marathon. Ideas to cut calories is difficult, and it's different for each person, I would say. But simple examples like reducing the size of your coffee if you put a lot of cream in your coffee, swapping breads, choosing a better bread, skipping spreads on sandwiches, cutting your meat portions, swapping a piece of fruit for a vegetable, and we'll get into that a little bit more specific. This is just a chart of what it means to lose 5 to 10% of your body weight. So if you're 200 pounds, that's 10 to 20 pounds. Again, a lot easier said than done. You don't have to do it all in a month. This is a marathon. We want having healthy lifestyle choices, not cutting all the weight in a week. That's not possible, and it's not something we recommend. But this chart also shows, just 5 to 10%, if you weigh 175, that's potentially 9 pounds. It can make a significant difference and prevent the future risk of developing diabetes. So how do we achieve weight loss? There's several different methods. There's lots, and everything's going to be different for each person. I'm just going to generalize some general methods, and if you like a certain one, write it down. You can kind of choose to do that and work on that. Weekly self-weighing. Some people say, yeah, let's do that. Some people like the stats and being able to trend numbers over days or weeks to kind of see how they're doing. Eating a breakfast. A lot of Americans skip their first meal, me included. That can help, though, fill your belly and you're not as hungry at the end of the day. Drinking lots of water, getting good sleep, eating healthy foods. I think avoiding the fad diets is something that's important. Choosing something that you can stick with rather than going for what's popular. You have to do what works for you, not what's popular. Chewing each bite twice as much as you normally do. Chewing each bite twice as much can allow you to feel fuller on less food. Research suggests that you can reduce what you eat at each meal by 100 to 120 calories just by chewing your food a little bit more. Putting away your phone during meals. So those who don't put their phone away during meals tended to not remember their meal well, felt less full, and snacked more in the afternoon. Using a smaller plate, so if the size of your plate is smaller, you don't eat as much, and that you can eat 25% less food potentially. And then tracking your food, some people do that to feel more accountable. Getting a buddy to do this with, a friend, family member, or joining a program like Weight Watchers. I think food's the best first medicine. It might be even something you're eating in your diet that caused this whole issue, prediabetes, diabetes to begin with. So we really do focus on the food in the office with these diagnoses. Healthy eating patterns. U.S. News and World Report ranked DASH, which is dietary, it's an acronym. Where's the DASH? Here it is. The DASH diet. Dietary approaches to stop hypertension. And the Mediterranean diet, the U.S. News and World Report picked these two as the diets to try 3 years ago. The Mediterranean diet emphasizes primarily plant-based foods, fruits and vegetables, whole grains, legumes, and nuts. Replacing butter with healthy nuts, healthy fats, such as olive oil, can be helpful. Using herbs and spices instead of salt to flavor food. Salt causes high blood pressure. High blood pressure is a risk factor for diabetes. Limiting the red meat to no more than a few times a month. And then also for proteins, eating certain fish and poultry at least twice a week. Drinking red wine in moderation. And getting plenty of exercise. These are healthy eating patterns. Here we have a food pyramid, kind of what I was talking about with the Mediterranean diet. They say wine in moderation. I think that's important, in moderation. It's a classic thing that people do to kind of, and they forget that that alcohol has blood sugar in it. Here's another picture of the Mediterranean diet on a plate. Grilled salmon is okay. So what we're looking at is half of this plate is vegetables. A quarter is a protein. Another quarter is starches. And they have examples of what a starch could be, like couscous, wheat pasta, garbanzo beans, kidney beans. Good vegetables to eat, greens, tomatoes, bell peppers, cucumbers, olives. There are certain fruits that are better than others for blood sugar. Some fruits, like grapes and oranges, have a high sugar content. There's other fruits like figs, strawberries, raspberries that have a lower blood sugar content and affect your blood sugar less. This is the DASH diet again. This is usually I tell about with patients who have high blood pressure rather than prediabetes, but I think generally speaking this is a great diet to really focus on. Again, about a quarter of the plate is grains, a quarter of the plate is proteins, and we have mostly half of this plate with fresh fruits and vegetables. I don't really even use the word diet all that much in the office when I talk about prediabetes. I'm talking about lifestyle, because I think diet has a certain connotation with it. But lifestyle is something that you want to maintain, positive choices, exercising. It's just the DASH and the Mediterranean diets promote a good lifestyle. So it's kind of interchangeable, but I usually don't use the word diet too much in the office. DASH diet also focuses about red meat, sweets, fats, and small amounts, focusing on low saturated fats, cholesterol, and total fats. Some fish, poultry, legumes are good sources of protein. Nuts and seeds a few times a week too. Another thing that sometimes people do to limit the amount of carbohydrates that they take in on a day-to-day basis is how they form their plate. You can actually go to myplate.gov, which is a website, and you can get a personalized MyPlate plan. It shows, the plan kind of shows your food group targets, what and how much to eat, within how much calorie that you tell the plan that you want. The food plan is personalized, it's based on your age, sex, BMI, physical activity level. But before you eat, what we want you to think is what you put on your plate, in your cup, in your bowls. Enjoy your food, but eat less. The oversized portions, I think, is where a lot of people go wrong. When we're talking about grains specifically, with rice, pasta, bread. And so there's certain amounts that you should be eating. Typically with rice, for example, it shouldn't be more than just the size of your fist amount of rice on your plate. Again, a quarter of your plate should be grains only, not a half, which is typically what we do, is we fill that plate up with grains and pasta, but really it should be only a quarter. And that can really, that simple change can be all that you need to do sometimes. All right. I think it's also important to vary the proteins. Some people get bored with just chicken, steak, chicken. So fish, poultry, there's beans, other types of proteins in the diet. We're going to go over some other methods that some people use to work on their blood sugars. Carb counting can be one thing. I think, again, focusing on portions is just as good, but if we get to that level where we need to do carbohydrate counting, like in diabetes, then we do it. Fiber, okay, fiber doesn't require insulin, so it's not really counted as part of your carbohydrates. So we like to tell patients to eat lots of fiber when they first get diagnosed, but you have to go slow, because if you're new to fiber, your body needs time to adjust to that. So you don't want to just fill up on lots of fiber, you won't feel great. And it's kind of just, the fiber can be helpful. Food order, can also be helpful. So like if you eat your protein and your vegetables before your carbohydrates, you may feel more full and less likely to want to eat those carbohydrates. Some people use other supplements like cinnamon, which has shown some, but the evidence is kind of out, and vinegar to help reduce their carb intake. And resistant starches can improve insulin sensitivity in people who have metabolic syndrome. Oats, barley, beans, cooked potatoes, green bananas. Okay, and we can get into that more if you have more questions. How to achieve weight loss. Exercise, exercise, exercise. It's a funny little joke that I liked. This is a doctor saying to the patient, taking an aspirin once a day, and to prevent a heart attack, you can take the aspirin to the gym, you can take it out for a jog, you can take it for a bike ride. So it's kind of cute. Anyways, if you're not exercising and you lead a pretty sedentary lifestyle, 30 minutes 5 to 7 times per week can be daunting, and it almost makes you not want to do any of it. Where to start? I always tell, go slow, build. If you don't do anything, go for a 5-minute walk for a week every day. Then the next week, you go to 10 minutes, and you increase as your body, your muscles are getting stronger, and then you work your way up to 30 minutes, and you do that 5 to 7 times a week. What are we talking about? We want your heart moving fast. You don't need to be sweating, you don't need to get the entire shirt soaked, but we want your heart moving fast. I tell patients to move at a brisk pace, like as if somebody was chasing you in a movie and you wanted to get away. A brisk pace where the heart's going good. Some research was found that being physically inactive for as little as 2 weeks increased blood sugar and insulin levels in older patients with prediabetes. We're usually talking greater than 65 years of age with that study. The study found that even if patients resumed their normal activity levels, many of these older patients weren't able to get their blood sugar levels back down to where they were at a healthier state. Also, so I mentioned mostly aerobic exercise. Weight training, core training is really great too. So that's what this is, 2 days of resistance training. I tell my patients, work out every day. Now, do I expect them to work out every day? No, that's high expectations. But then they have it at least in the back of their mind, hey, Dr. Barnett wanted me to be moving every day, even if it wasn't for a huge jog or run, just moving every day. And then hopefully you start building routines and you start wanting to work out regularly. Benefits of exercise. Obviously, we're talking about diabetes. It prevents reducing your risk for diabetes. It reduces the risk for cardiovascular disease, some cancers. It improves bone density, a decreased risk of hip fractures. It can improve pain, quality of life in patients with arthritis. It can improve your sleep. It can decrease your risk of falls. It increases your longevity. It improves mood issues. It improves memory issues and decreases your risk for dementia, memory loss. When we're exercising, we have to look, we're doing this for the long game. We're not doing quick perks. Exercise has incredible long-term success. Everyone feels better after exercise. So it always might be hard to get going, but once you get going and it's all done, you typically are always feeling better. Starting an exercise program, I mentioned that with Weight Watchers earlier. I would say talk with your doctor before starting an exercise program. I also mentioned starting slowly and increasing the duration, frequency, how much you're working out gradually. But the end goal is to get to 30 minutes daily, 5 to 7 days each week. I say daily. And again, just another idea, 10 minutes 3 times a day is just as good as 30 minutes in a row, as long as the heart rate's going. You can park farther away when you're going to the grocery store. Go up an extra flight of stairs instead of taking the elevator. All these little types of things can be beneficial. Also, working out before breakfast. A study in Japan found that when you exercise before breakfast, you actually metabolize your food throughout the day better and not as hungry at the end of the day, compared to when you're doing that same workout in the evening, after meals. So working out before your breakfast. Pharmacologic intervention, or medications, prescriptions, they can lower the risk of diabetes by 45%. Typically, the main one we're talking about is metformin. Metformin has a good safety profile, really well tolerated. You take it with food, and it has beneficial effects not only on your weight, your cholesterol, but also your blood sugar. What it does is it works in the liver by improving insulin sensitivity and decreases glucose manufacturing, which is making of blood sugar, glucose. Typically, you take it twice a day. And again, you would talk to your doctor about this. There is, so treatments, this is, like I said earlier, metformin we don't really typically use except for specific populations. I'm going to talk about that next. When do we decide to use metformin? And it's in this box right here, in the bottom left. So let's just kind of go through this whole thing. Treatment recommendations for people who have impaired fasting glucose. Impaired glucose tolerance is IFG and IgT, or an elevated hemoglobin A1c. So if you have an A1c 5 to 7, 5.7 to 6.4, or impaired fasting blood sugar, the doctor's mostly going to say to you, lifestyle choices, just what we just talked about. But if you have these types of things and you have some risk factors, you're young, your BMI is higher than 35, or you're a woman with a history of gestational diabetes, the doctor may recommend metformin, and this would be twice a day. You would take it with the food. But this is much less common. I would say we work on lifestyle modifications the most. Surgical intervention, sure. So for the morbidly obese, if you have a BMI greater than 40, or if you have a BMI greater than 35 with a risk factor for diabetes, you may be a good candidate for bariatric surgery to help sustain your weight loss long term. Sleep. I think sleep's really important. There's some evidence that suggests that sleep loss is associated with an increase of risk of obesity or gaining weight. Sleep restriction can lead to hormone changes, which can favor an increase in calories and decrease energy expenditure, and ultimately leads to weight gain. It's an important sleep's important for metabolism. Sleep loss has been shown to also cause issues with mood, alterations including glucose, blood sugar issues, and increased appetite. Also, the evidence suggests that obstructive sleep apnea, poor sleep quality may increase obesity risk. There's some studies. I'm not going to spend too much time because I think it's a little too heady sometimes to go through it all, but just briefly, the first one is the Diabetes Prevention Program. In this study, it was followed for 3 years. What we found is that a low-fat diet and exercising 30 minutes 5 times a week, or 150 minutes per week, resulted in a goal of 7% weight loss versus the control. And what we found is that 14% developed diabetes versus 29% in the control group. A 16% reduction for every 2.2 pounds lost. There's also a study that showed a reversion of normal glucose levels, even transiently, was associated with a 56% reduced risk of future diabetes. So if you get diagnosed with prediabetes and you work on lifestyle choices, this transient reduction of blood sugar can reduce your risk for future diabetes. This study was interesting. They did a study that randomly assigned patients with prediabetes to receive a placebo drug, which has no chemicals in it, versus just lifestyle changes. And what we found is that the people, and this on the top, the y-axis, this is cumulative incidence of diabetes. So people who developed diabetes from prediabetes, people who took the placebo and didn't do any exercise or sedentary, did worse than people who just worked on lifestyle. And I think that's another kind of key point, is lifestyle choices and making the choices you make are so important. This study also showed that while metformin lowered the incidence of diabetes, it's not as good as lifestyle intervention. But it can also be used to help. So all it takes is exercise and weight loss to reverse diabetes. I wanted to talk to you about the Diabetes Prevention Program, which is offered by Boulder County Area Agency here in the Boulder Valley. What they do is they're a proven behavioral change program developed by the CDC, and you have lifestyle coaches that provide support and guidance. It's a year-long program with weekly meetings for 6 months, followed by 1 to 2 a month for the second 6 months. The Diabetes Prevention Program, if you want to screen grab that if you can. Also, we'll have data at my office if you want to call there. The number will be provided. But you can join for an informational session in person on September 27th, or sign up, kind of like this, September 30th, 11 a.m. to 12 p.m. There is limited space, so I want you guys to sign up early, please. The classes are offered free of charge, but you have to be a qualified participant, so there's some pre-registration. You can call this number to find out if you're eligible at the bottom, 303-441-4710, or email infohealthyaging@bouldercounty.org. Another thing that we have in our community in Longmont, the Flatirons Family Pharmacy offers prediabetes education classes at no cost. So this is pretty cool. I reached out to my diabetes educator at the office, and she provided me with some really nice just follow-up help with prediabetes classes that are free. The Flatirons Family Pharmacy is working in partnership with the Colorado Department of Public Health and Environment, and it provides these classes to the first 20 patients who qualify and pass this pre-assessment test. They're certified health coaches at this pharmacy. You can call Rodney, who's a clinical pharmacist, at this number below, the 303-827-3480, or email Rodney d@flatironsrx.com. So thank you very much. It was a pleasure to speak with you tonight. Yeah, we're going to go to questions now.
Thank you, Dr. Barnett. That was very informative, and we do have quite a few questions.
Oh boy.
And then some will continue to come in.
Okay.
And some of this I think you've covered, but there's some requests to
go over it again.
Give a couple of spots again. The first question is, what is a safe amount of sugar and carbohydrates to eat every day? Like, is there a number?
It's a good question. One moment, let me just peruse my notes.
Okay, take your time.
And again, with prediabetes, yes, we are focused on blood and how much sugar you're consuming, but we don't really get to carb counting and blood sugar counting as much with prediabetes. We're doing that more with diabetes type 2 that's really uncontrolled with hyperglycemia.
I see.
One moment. So in other words, I don't have the exact number in my brain, but I know I wrote about it. One sec.
Take your time. We have time left in our schedule.
Right.
I don't know if your presentation gave just a number of a safe amount of sugar and carbs, but
yeah,
it
no,
does
it's a
say
great
to keep
question.
it moderate.
So when we're focusing on healthy eating, calorie reduction, we're talking about you want to reduce your calorie count by 500 kilocalories per day. So if you have 3,500 calories is equal to 1 pound, lose a pound a week, you need to cut back by 500 calories. I don't have the information about sugar right now.
Okay.
Yeah.
Excellent. How about this? Does sugar-free juice increase sugar in blood?
No.
Excellent. Will you remind us again what are good A1c numbers for a healthy person as well as a glucose number?
Sure, absolutely. I'm going to just rewind on my slides a little. Do they still have access to the pictures?
They do? Mm-hmm.
Okay.
Oh.
A healthy person. Here we go. So we're talking over here on this column, less than 100 on a fasting blood sugar. If you went to the doctor and you accidentally ate or had some cream with your coffee before you had your blood sugars checked, and they do a random blood sugar, it should be less than 140 to be considered normal. and then an A1c of less than 5.7%. So 5.7% is considered prediabetes. So technically 5.6 or less.
Excellent, thank you. Let's see, let me just go and order them. Is intermittent fasting helpful in the management of blood sugars?
Yes, there's been some studies. I didn't go into it again because I think it's a fad diet currently. And like I said, I think it's important to stay away from fad diets. Now, if you like intermittent fasting and it fits with your lifestyle and you don't feel like you get too tired or fatigued and aren't able to be professional at your job or social with your friends and family, then go for it. I think that's fine. But I would say I don't like fad diets, and I want something that you want to sustain long term. So that's why we're focusing on healthy lifestyle choices. Intermittent fasting, I don't know how sustainable that is long term. But yeah, people do it.
Right. What is the main reason, do you think, for the diabetes epidemic in the United States?
Sedentary lifestyle. I think it goes along with our Western culture, unfortunately. We also have huge portions. For example, when you go out to a restaurant, the portions that we're given and expected to have, we love it, but also they're really big portions. And so I think that's the biggest part, is just our sedentary lifestyle, our large size portions, and not exercising and being active enough.
Excellent. Do you know of any non-sugar sweeteners that are good and safe that come to mind right away?
As somebody who kind of avoids sugar altogether, I don't. One thing you can always do, and I know that Googling things can be scary, you can always go to google.com and type in non-sugar sweetener replacements, and there's usually a good list there that are pretty reputable. So,
why do cells start to reject insulin?
So insulin is a hormone, protein, and over time, as the blood sugar in your body, for people who have type 2 diabetes, the blood sugar gets so high in your bloodstream for so long that the insulin is no longer, it's not sensitive to it. It doesn't respond to it. And so blood sugars stay high in the stream because the insulin no longer functions. Does that answer that question?
Excellent.
Yeah.
Yep. How exactly does smoking cigarettes increase your chances of diabetes?
That's a good question, because you're not eating sugar when you smoke cigarettes.
Yeah.
Tobacco, however, causes constriction of our vessels. I had mentioned how diabetes is a risk factor for heart disease. Smoking causes heart disease. And so when doctors meet somebody who has diabetes, we almost think of it as a quote-unquote coronary heart equivalent, meaning in our brains, people who have diabetes are at risk for heart disease equally as somebody who just had a heart attack and was coming out of the hospital, even if that patient with diabetes has no heart history. So they're at increased risk for heart disease, and because smoking, high blood pressure, diabetes are all risk factors for heart disease is also a risk factor for diabetes. It's kind of reverse equivalence.
I see. And marijuana
Excuse me?
smoking? Marijuana smoking? Does it?
Affecting prediabetes? No, I would say no. But marijuana can lead to eating more, and especially at nighttime, and that can lead to prediabetes. So indirectly, yeah, absolutely, 100%.
What advice would you give to someone who is pre-diabetic yet underweight with a low BMI yet sedentary?
So that's a great question for your doctor in the office. I think we're not going to get too much into specific examples, and I think that's a fairly specific, less common example. So I'd say please call your doctor's office and make an appointment to discuss that. Thanks.
Is chronic fatigue a symptom of pre-diabetes?
No, chronic fatigue is more of a symptom. It can be many things. I mean, there can be an array of things that cause chronic fatigue. Chronic fatigue can be multifactorial, meaning multiple things can lead to it. Prediabetes doesn't always have symptoms. And when we talked about my clinic example, this 48-year-old woman who just wanted to come in to get her blood work, that is the typical case, is somebody comes in for blood work, their blood sugars are mildly high, and we chase that to figure out if it's prediabetes or she just ate before the lab test or something like that. So, yeah.
Excellent. I'm going to ask you a couple of questions about different diets and systems, and you can tell us if you know much about those. Do you know anything about the Nutrisystem for weight loss? And if so, do you feel it's helpful in preventing
I'm not familiar.
Right. Yeah, this kind of processed foods there. Also, about the keto diet.
Excuse me, what?
The keto
Oh, keto
diet. Unadvisable for pre-diabetic?
Not unadvisable. Again, it's what works for you. I would say it's a fad diet. It's a fad diet, and I'll just repeat myself. I think it's more important to focus on a lifestyle that is sustainable long-term. Fad diets, you typically burn out after 4 weeks of being on it, on average, typically. And I'm not going to really promote that or tell you to do that, I think. Yeah.
Is gallbladder removal especially significant in pre-diabetic?
No, in my example, I just wanted to have a past surgical history. That's a made-up case that I encounter frequently, but no, cholecystectomy, gallbladder removal is not a risk factor for prediabetes.
What are the best sources of fiber that you would recommend?
Yeah, that's a great question. If you're going to take it as a supplement over the counter, I recommend Metamucil. For food, I just want to go to my sources. Good sources of fiber. Vegetables are typically great sources of fiber. Salads, carrots, yeah.
All right. If you're eating no refined foods, should you also cut your addition of table salt to your food if you're not eating the salty refined foods?
In our Western diet, you get plenty of salt in a lot of the other foods. So I'd say, yeah, if you want to cut out salt, that's great. I'm an internal medicine doctor, and one of the things I focus on is low salt. Working on watching the blood pressure. So if you're going to cut out salt, I'm all for it. Go for it.
How long does one need to stay on metformin? Is it until your A1c is at a good level, under 5?
So that's always a discussion you have with your doctor individually. Every case is different. I would say I rarely discontinue metformin once it's started. I tell my patients indefinitely. Metformin is really helpful to control blood sugar. You don't have to take an injectable or anything like that, and it does a fantastic job. Some patients are able to get off of the metformin if they change their lifestyle. We're talking about overhauling a lot of things, getting that weight down. You can potentially come off of metformin, yes, but I would say it's more than the exception than rather what happens all the time.
What is the effect of statin on blood sugar level?
Statins we haven't really mentioned statins today, so just for others that don't know what statins are a class of medicine to help lower cholesterol and reduce your risk for heart disease and strokes. A lot of patients who have diabetes are on statins because, like I said, diabetes has an increased risk for heart attacks and strokes. So patients who are on statins, patients who have diabetes are typically on statins. Does it cause increased blood sugar? I don't think so. I do know that it can cause Actually, no, I think there was, atorvastatin does cause increased blood sugars, and that's just part of something we are aware of when we prescribe statins, that it can cause an increase in blood sugar. Yes, we take that into consideration. But the benefits of statin have been shown to be so important that we do recommend them, even if it causes a transient or a mild elevation in blood sugar.
Perfect, perfect. Let me just put this right here. One more question,
Okay.
please. I think we have time for one more.
Okay.
I'm sorry, I'm sort of
No, you're fine.
looking and typing and sending a message all at the same time here. All righty. All right. So, last question, I think it's important. I just got a continuous glucose monitor, a CGM.
Yep.
Do you have suggestions on how best to use it?
People who use CGMs are usually with diabetes because they have to check their blood sugar so often. And what was happening is people who have high blood sugar are checking their blood sugar 4 times a day. So these continuous glucose monitors are inserted subcutaneously on the arm, and you can just put your app or a cell phone over it, and you can get a blood sugar pretty quickly. Prediabetes, we do not do continuous glucose monitoring. If you have questions about the continuous glucose monitor, I would reach out to my clinic, the diabetes educator, but we're not going to go over CGM right now. That's a whole nother lecture.
I see, I see. Can you remind us again where you're located?
Yeah, I work in Longmont, Colorado on Ken Pratt Boulevard. Let me go to that. Right, oh, it doesn't have my address. That's too bad. But 2101 Ken Pratt Boulevard in Longmont, Colorado, 80501 is my address. And here's the number that you can call for appointments.
Excellent, excellent. Thank you, Dr. Barnett. There's really good information. We've come to the end of our time.
Okay.
If folks have any other questions, they can email them to pr@bch.org. And so for all of you joining us tonight, we have come to the end of our time. A recording of tonight's lecture is available at bch.org/livestream. You will receive a post-lecture survey by email. Please take a minute to fill this out. The hospitals, we're all very interested in your feedback from these sessions. Again, please visit bch.org for information on the COVID-19 vaccination information. Thank you for joining us. Thank you, Dr. Barnett.
You're welcome. Thank you.
Thank you all, and have a very nice evening.